distracted, then how you are going to tackle. So mortuary has a great importance to manage disaster impact on society, to manage the dissemination of different kind of vector borne disease during the time of disaster. So mortuary should be well prepared in every city, or a temporary mortuary should be created for this purpose to handle the mass. Now after a major disaster, this is likely to be so great that organized relief will be able to meet the demand. Sorry, I should go to the next slide. And I would like to display some photographs to you, because these are the photographs that we could see generally during the time of disaster. And you can see overcrowded in the hospital sectors, and you can look why this photo I have presented over there. There are only 2 to 3 patients you can see, but the number of people watching the patient are more than 10. So this thing also should be managed during the time of disaster, and this is one of the most hazardous thing. So this thing should be managed, overcrowding should be managed, and you can see how the disaster occurs and how the homes suddenly they fall down and they create some kind of chaos in the society. And also mass accident is also when there is a bus accident, or when there is accident of a train or some aeroplanes, then we also count that like it's an disastrous impact to the society. Again we need the implementation of triage in this time. Again we need to handle the mass casualties. So this all comes under the triage. Okay, now coming to the next slide. Here we mainly we must focus on identifying the victims and the immediate relief of the victims. So what are the methods that you could help to serve the people during the time of disaster to get immediate relief? As my previous colleague has already mentioned that we have triage system, color coding system, so that we can differentiate which patient is which person is needed an immediate care, who is needed care after 24 hours, who might need care after 2 to 3 days back, just after monitoring their vitals. So these are the things that we can identify the patient and manage the patient, as well as manage the crowd by triage method. And this triage method is a part of pre-preparedness. I would like to pre-preparedness as well as during the time of disaster. But post disaster, if you talk about post disaster issue, then rather than triage we focus mainly on follow up of the patient. Generally what we lack during the time of disaster is that we do not follow up the patient, and I still remember one live examples. If we don't follow up at the site of disaster, there might be some victims left in the home. They are not aware that okay, if my bone is exposed out of the muscle, it can be infected and I should go through the part of surgery called amputation. So I have seen such kind of scenario, a small child coming from a village after 3 days, I mean after 72 hours, and she was already infected with bacterial infection in her bone, and we have to do amputation for such a person or a child. So awareness program along with post disaster, awareness program should not be done only before disaster. Awareness program should be done after disaster, as well as serious follow up should be done even to prevent the life threatening situation, like either that is like open fracture, or either that is someone is suffering from sepsis, or someone is having some neurological features but we are not able to reach them. So follow up is most important to minimize the life threatening injuries due to the disaster, and this will have a positive impact on public health, and this will of course there will be the best chance of surviving. Now I would not focus on road traffic accident because we have limited times as well. Natural disaster, I could see there are types of natural disaster like landslide, earthquake. I have explained this all ago. Now talking about war victims, how do you see war victims? So during the time of war, again there are thousands of army they get injured, or there are more than 5,000 or 50,000 of the army from both sides are getting injured. So how you are going to handle this kind of problems? So this also comes under disaster management. Handling a mass casualty during the time of war or after the time of war. Also the techniques of the disaster management should be implemented in this kind. And I would like to inform you that recently I saw a video on a social media like LinkedIn, in an official platform, that NATO has discovered a kind of device in collaboration with University of USA, and that device will monitor the vitals of the person, as well as that will immediately show the status of the person, even the circulation. For example, from outside visualizing the patient with your eyes, you can just help with your skills to color code them. Okay, this is much dangerous one, put this in red. This is not able to survive, okay, put this in critical zone. So but this device allows an army officer to look to look the injured army, to immediately measure what the thing, if there is any internal hemorrhage, that device will immediately monitor even the internal hemorrhage, and that will help you to more, I mean the things that you could not assess with your eyes or with your external equipments, that device will help you. So regarding war victims, I would like to just inform you that this kind of instruments has been already invented, and that will give you a report within 30 seconds to 45 seconds. Another is the accidental blast. This also comes under the war victims. So now coming to the next slide, this is the important part, I think, because something if happens and then you are going to control it, it has already occurred, and it could have, like already there are 10,000 of mass of people that has been affected, but we can reduce its impact before that. That is known as pre-preparedness, I mean precautionary measures. I have mentioned the word precautionary measures, forecasting and taking precautionary measures before an imminent threat when warning are possible. Again, how do you give the types of, what are the types of warning? By collaborating with, as every government in most of the country, in each of the country, I think they have disaster, there are some organizations that always monitors the kinds of disaster or certain kind of landslides that are that may arise. So pre-preparedness part should be focused by taking information on that part, and you should be pre-prepared. And regarding pre-preparedness, I would always also like to use the term, there is a term like disaster reduction, disaster risk reduction. So what I did as a practical approach on the ground level, that first you can train the people about disaster risk reduction. So what are the parameters that you could help to reduce the impact of disaster? We cannot control earthquake, but we can help to reduce the impact, like we can control the landslides, we can have better water management even in the sea or in the river or in the ocean, so that to prevent the communities. So this all part is done by disaster risk reduction team. So the team, the youth members, those who get training about disaster risk reduction, we call it the team of disaster risk reduction, or DRR team in a short. So what this DRR team can do? Yes, this DRR team now, when after receiving certain kind of training by Red Cross or some trained member, now they can be used for pre-preparedness part, either that is of awareness part, or that is to prepare the community to get shifted from one place to another place if certain kind of volcanoes or certain kind of landslides or floods are I mean, if we get the information that okay, this is going to occur. So pre-preparedness should include DRR team as well. Mainly I would like to focus on disaster risk reduction part at pre-preparedness section. What is about scale up response? To make something larger in size, amount, etc. That is this deals with the instrument part. So right now talking about what action we should take. So during the time of disaster, it's not that you are planning for a policy and then you are going to implement at a ground level. It's a part of emergency action. Facilitate recovery efforts, reduce the impact of an emergency event, a document that guides operational activities of the incident command system. Now catching this point of incident command system once again. Incident command system can be created by not only by, during the time of disaster in most countries you could see there are some police officers or some paramilitary forces working to go in some kind of endangered zones or help people to get separate from migrate from that kind of zone. But what I focus that even youths of the community or youths of the city can be trained for this system, and you can make it an incident command system that okay, this is the location you have, you can come and take food, you can come and take shelter, you can come and know about your lost one, you can inform, or if you have to inform something you can leave the message over there. So these all parameters comes under incident command system. During the response phase to a particular, and this is also a part of response phase of the disaster. Now what are the emergency management? Organization and management of the resources and responsibility of dealing with all humanitarian aspects of emergency. So mostly the humanitarian aspects, like what are the humanitarian aspects? So you could see that clothes are being distributed during the time of disaster, some kind of the person who are disabled, so we can give some kind of instruments that would be help to them, for example wheelchair distribution I could see for a disabled person in a large scale after disaster. So these kind of humanitarian aspects, also food, clothes, wheelchair, or some kind of splint, ortho instruments, you can provide them as a part of emergency care, not as a part of relief care after 3 to 4 days or after 10 days. Okay, now what are the 5 steps of emergency management? First step is that you have to identify the most risk. What are the most vulnerable zone? Who are the most vulnerable people? And you should never forget of 3 kind of people, I mean 3 kind of category of the people. Pregnant ladies, first to be shifted out of the disaster zone. Childs, they should never be left alone even they have missed their parents. And another is the old age people, because they cannot run, they cannot hide properly. So you should migrate them on the first, because youth can run, youth can mobilize, youth can be migrated by their own effort. So knowing the risk, knowing the vulnerability of the location as well as of the people, most vulnerable group of people. Now build a team, again this come to DRR team, make a critical information quickly available. I have been repeating in this presentation that you have to give an emergency response to the site of disaster, I mean at the site of disaster. Update alert, again alarming system, that can be by a technical alarm that will produce a sound that okay, landslide is approaching your, I mean flood is approaching our city, or some kind of alarming sound, okay, at this moment if we put an alarm you should hide